Hello, and welcome to another segment of Let's Get It Straight. I'm Katherine West, Infection Control Consultant. This segment is going to deal with raising some awareness about what you may not know is in place about pandemic response. And it's really pretty cool. So let's get started. Media headlines grab our attention, and that's what they're designed to do. But I'm going to caution you about following them and what they state. For example, the most recent involved Marburg Virus outbreak, which is a hemorrhagic fever that took place in Rwanda. Now, the CDC published a situation summary on this in December of 2024, early December. And as you can see, it says the Republic of Rwanda confirmed more than 60 cases of Marburg virus disease, primarily associated with hospitals in Kigali, including some deaths. This was the country's first Marburg outbreak. Marburg virus is rare but severe as far as hemorrhagic fevers are concerned, similar to Ebola, and can cause serious illness and death. At this point, and the start of the cases in Rwanda occurred in September of 2024. So on December, it was stated that no cases related to the outbreak have been reported outside of Rwanda, and that risk for virus infection coming to the United States was deemed to be low. There are EMS guidelines for caring for a patient suspect or diagnosed with Marburg virus, and these were actually published in March of 2023. However, look at this photo, and it was published stating that this was headlines for EMS guidelines. Not true. This started with the very beginning of Ebola in this country and concerns about lining vehicles with plastic. But that is not what is in the EMS guidelines. So this photo is a real problem. As I stated, the photo was for Ebola and stated or led the reader to believe that this was the current CDC guidelines for personal protective equipment for EMS in now talking about Marburg virus. The message here is don't jump the gun on what you see. Don't immediately react to, for example, that photograph without checking things out before your departments respond. So the protective equipment for healthcare workers in EMS published by World Health and the CDC stated we would use standard precautions, droplet, and contact precautions. That we would avoid contact with contaminated surfaces. And when within 3 feet of the patient, because this is bloodborne but also droplet transmitted, we would wear a cover gown, gloves, a face shield or mask with protective eyewear, and conduct good hand washing. So these were the actual EMS guidelines for Ebola. Now, with regard to Marburg, published in March of 2023, was a statement saying it is unlikely that EMS personnel in the U.S. would be caring for a patient with Marburg virus disease during your routine operations. It goes on to state that, however, an outbreak elsewhere in the world would increase risk of encountering a patient who recently traveled from the affected area and became infected. That is going to lead us now into what you may not be aware of that is in place to protect us from viral hemorrhagic fevers coming into the United States. So the question is, why does it say it's unlikely? And that's where we're going right now. So let's discuss what is currently in place. And that is a process of outbreak notification. If there is an outbreak in a country, the country notifies the World Health Organization. That country with the outbreak begins to contain the cases by quarantining individuals believed to be infected and by putting in place travel restrictions. In a country in which there is an outbreak, if they find that the outbreak is not contained, they will notify the World Health Organization, and an international alert is sent out. And then what goes into effect is a piece you may not be aware of, and that is the International Travel Agreement. So what is the International Travel Agreement? If a traveler from an area where there is an outbreak is trying to enter, say, the United States, they will automatically be reticketed to an airport near one of the designated regional treatment centers in the United States. Now, we originally started with 10 of them. Then it went to 13. Then it went to 35. And as of today, which is January the 10th, that number is up to 107. Centers which have been trained to handle these persons. If medical evaluation is needed, then the patient is transported by an EMS unit that is affiliated with one of the designated treatment centers. Step 2 of this agreement is if there is an ill passenger on the plane, what happens? The crew notifies the pilot alerts the arrival airport, and a CDC team meets the plane and evaluates the ill passenger. No one is allowed to disembark the plane until this process has been completed. The crew is in charge of the back of the aircraft, and they are trained to observe for signs and symptoms, to render initial care if needed, and they report the ill passenger to the pilot. So they have a very important role. The crew has now notified the pilot that there may be a passenger on board with a communicable disease. The pilot will then notify the airport through air traffic control, and air traffic control will tell the pilot where to park the plane. So the plane will not be coming to the gate and passengers will not be permitted to disembark using the jet bridge. The pilot will also enable continued ventilation of the aircraft and allow easy accessibility to public health personnel. There is personal protective equipment available on all aircraft to be worn by aviation personnel. This will include disposable gloves, their practice of good hand hygiene, and they will also have surgical masks. If the traveler is suspected of having a respiratory disease, they will be asked to wear a surgical mask. Remember, source control. Control at the source. If that person is unable to wear a surgical mask, then the crew may wear the mask. The sick traveler is then escorted from the aircraft to a secondary area for additional assessment and/or treatment. Step 3 of the process is the CDC team determines the status of the patient. These areas at airports are termed CDC quarantine stations. If the patient is cleared, they may depart and the passengers on board are permitted to depart. If it is determined that the patient needs to be transported by a team to a regional center, then the passengers on the plane will be asked to complete a form for contact follow-up. And that information is collected by the CDC team. There is another governing document in the United States. It is actually a U.S. Code of Federal Regulations. The numbers are 42 Code of Federal Regulation 70.4 and 71.2b. This states that arrivals from outside the United States can be lawfully detained by the CDC if it is reasonably believed that they are infected. The crew is aware of disinfectant procedures that should be taking place if the traveler is deemed to be potentially communicable. All surfaces that that person was in contact with will be disinfected. This is very similar to cleaning in your vehicles, what we refer to as high contact or high touch areas, what the individual was in contact with, and then what was used to care for that individual. So it was stated and published on December 20th of 2024 that the World Health Organization declared the Marburg Virus disease outbreak in Rwanda to be over. You know, countries now have been trained to identify these illnesses and to contain the areas affected. That's a very important part. And we saw that work effectively with the last 2 Ebola outbreaks that have occurred in the Democratic Republic of Congo and in Uganda. No ill people or exposed individuals traveled outside of the affected area. So, are departments and personnel fully informed of the things that are in place with regard to outbreaks in other countries and individuals who may try to enter the United States. I think this piece is important to be aware of and, be a part of your prep training. Airports have responsibilities. Pilots and flight crews have responsibilities that all lead to, yes, it is unlikely that the average EMS service would be encountering a patient with Ebola, Lassa fever, or Marburg virus. The message is, sometimes you don't know until you know. So let's expand the education to address this key protective measure that's in place. I wanted to give you some key references to support what was presented in this training, and so that those responsible for addressing issues on planning for pandemic can also access this key information. First of all, the World Health Authority guidelines that are published by the International Civil Aviation Organization for State Authority Guidelines. The second reference is from the International Transport Association and their guidelines for safety aviation communicable diseases. And lastly, suspected communicable disease guidelines for cabin crews that were published in December of 2017. That will bring us to the end of this presentation, and I hope you found it interesting and enlightening. I did when I was learning about all of this. If you have any additional questions or would like copies of additional materials, please contact me either at my office or through email. I hope this information was really a surprise and brings some additional comfort. Thank you, and I hope you will join me for a future issue of Let's Get It Straight.